Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what is most urgent? Most of our listeners today probably know that the Centers for Medicare and Medicaid Services, also known as CMS, issued the final rule for fiscal year 2026 inpatient prospective payment system and long-term care hospital prospective payment system. These new rules will govern the statutory and regulatory requirements for inpatient hospital stays and long-term care, following a base payment rate determined by the diagnosis, acuity, and treatment of the patient. Now, here's a quick overview for those of you who may not know all the nuances of this. CMS predicts an increase of $5 billion, that's with a B, in hospital payments based on expected increases and decreases in care payments and more. Most inpatient rehab facilities will see a 2.6% increase in payments. For the first time since 2005, payments to teaching and rural hospitals will be adjusted for the cost of care. COVID-19 vaccination coverage will now be removed among healthcare personnel. The instrument that hospitals use for patient assessment data will no longer include 4 social determinants of health data, target and living situation points, such as food insecurity and utilities. The final rule also discontinues the low-wage index policy and finalizes the transforming episodic accountability model, which is a mandatory episode-based model for alternative payments. To read the full rule issued by CMS, visit cms.gov or find it on the Federal Registry. On to the damage report. Last week, Cardinal Health announced their purchase of Solaris Health to expand their multi-specialty strategy. Solaris is a urology service system with more than 750 providers in 14 states, and the deal closed at $1.9 billion. This is just the latest in California's serial acquisitions. Last year, Cardinal acquired a majority stake in GI Alliance for 71% ownership and the Advanced Diabetes Social Group to merge it with Cardinal's own home medical supply business. The federal government is canceling $500 million in vaccine research funding, as announced by Health and Human Services Secretary Robert F. Kennedy Jr. The canceled funding will impact the research behind technology that experts anticipate could be the strongest combat to a future pandemic. In 2013, providers joined together to bring an antitrust lawsuit against Blue Cross Blue Shield Association for allegedly dividing the market to benefit from increased costs to providers. Last October, the case reached a $2.8 billion settlement. But last week, nearly 6,500 providers opted out of the deal, following other providers that rejected it in March. This case represents over a decade of frustration and tension between Blue Cross Blue Shield and thousands of healthcare providers across our country. The providers rejecting the deal argue practices that originally prompted the suit have not changed. They're bringing new lawsuits that challenge the previous settlement. Now on to our success story. Last week, we had a special Rural Health News episode to announce our Rural Health Strong campaign. As a reminder, this is a Hillsdale Hospital brand new campaign to promote the value of rural health for our communities, and it will be our avenue for advocacy, including on this podcast. For today's success story, I'd like to invite our listeners to participate in this campaign. Join us in our mission to protect rural health and preserve the future of both our industry and our neighborhoods. Here's how. Submit a photo that represents rural health to you. We'll be posting these photos along with our own to promote the campaign and help our audience visualize rural health. Send us a story. Tell us what rural health means to you and why it needs to be protected. All of this can be done at hillsdalehospital.com/ruralhealthstrong. Lastly, follow along. We'll be publishing several series of legislative updates, op-eds, testimonials, and more on the social media pages linked in the show notes. Stay engaged in Rural Health Strong campaign and help us turn up the volume on our message to our communities, lawmakers, and this nation. Thank you to our sources for this episode: Modern Healthcare, Cardinal Health, National Rural Health Association, Centers for Medicaid and Medicare, Becker's Hospital Review, and KFF Health News.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.